Treatment of urinary tract infections, also known as UTIs in females. Urinary tract infections are categorized into two main types: acute simple cystitis, also known as an uncomplicated UTI, and acute complicated UTI. Diagnosis of UTIs involves a thorough evaluation of patient symptoms, followed by specimen collection for urinalysis and a urine culture. The urinalysis helps in identifying the presence of bacteria and other abnormalities, while a urine culture provides a valuable information on the specific type of bacteria that is causing the infection. Treatment strategies for UTIs vary depending on the type and the culture results, allowing for tailored approaches to effectively combat the infection and prevent reoccurrence. This table was taken from Up to Date. It is categorizing UTIs in adults, and it discusses the symptoms with each specific category, which we will discuss in further slides. But the importance of proper categorization is crucial for guiding appropriate diagnostic and treatment approaches and ensuring optimal management and prevention of complications associated with UTIs in adult patients. Acute simple cystitis, known as an uncomplicated UTI, is a common urinary tract infection that typically occurs in healthy individuals with normal urinary tract function. It is confined to the bladder, not involving other parts of the urinary tract like the kidneys. Symptoms of acute simple cystitis include urinary urgency, frequency, dysuria, and lower abdominal discomfort. Fortunately, this type of UTI is usually treated successfully with short-term antibiotics, typically lasting 3 to 7 days, effectively resolving the infection and alleviating the symptoms. This is all from Up to Date. This is the treatment algorithm for an outpatient therapy in non-pregnant women for an uncomplicated UTI, and I got this from our textbook on page 695. So we are basing this treatment plan that's saying that this is an uncomplicated UTI. Yes, the patient does not have a sulfa or nitrofurantoin, which is also known as macrobid. So no allergy to that, no. So we go straight to the macrobid treatment. So for the treatment of the uncomplicated UTI, these are the options. This is from Up to Date, and it pretty much matches up with the algorithm we just saw, except they have some additional medications that can be also used. So first line would be the macrobid, 100 milligrams orally twice daily with food for 5 days. Or alternatively, we can take this one, which is known as Bactrim, one double strength, which is 160 800 milligram tablet orally twice daily for 3 days. Up to Date says that if all of these are appropriate options based on patient circumstance and prior urinary isolates, we suggest the macrobid or the Bactrim as the medication for treatment. So for this specific patient, let's say we chose the macrobid. So let's just go over some contraindications and adverse effects. So macrobid, while effective in treating urinary tract infection, comes with several contraindications. It should not be used in individuals with a known allergy to the medication during pregnancy or while breastfeeding. Additionally, caution is advised in older patients with decreased renal function, as well as individuals with hepatic impairment. Macrobid should also be avoided if there is suspicion for early pyelonephritis or if the creatinine clearance is below 30 mLs per minute, as it may exacerbate existing renal issues. Now, macrobid, like we said, effective in treating UTIs. It could lead to various adverse effects, such as some gastrointestinal symptoms such as anorexia, nausea, vomiting, diarrhea, are commonly reported. There's some pulmonary reactions, which include dyspnea, chest pain, chills, fever, and a cough. While rare, severe liver injury is a potential risk. Additionally, peripheral neuropathy and some hematologic effects such as hemolytic anemia, granulocytosis, leukopenia, thrombocytopenia, and megaloblastic anemia have been observed. So carefully monitoring the complete blood counts, known as CBCs, during treatment of macrobid are important. Nursing considerations for macrobid administration include advising patients to take the medication with food to mitigate gastrointestinal upset and ensuring adequate fluid intake. All oral antibiotics are better absorbed with at least 6 to 8 ounces of water. Patients should be educated on the importance of completing the full prescribed course of treatment, even if symptoms improve, as this will help prevent the development of antibiotic resistant infections. In the event of a missed dose, patients should take the medication as soon as possible, but they should skip the missed dose if it's nearly time for the next scheduled dose to avoid doubling up. Monitoring baseline um, BUN and creatinine levels is essential, especially in elderly patients or during long term treatment, and liver function tests such as LFTs should be periodically checked as well. Now we will move to the acute complicated UTIs. So, acute complicated UTIs represent a subset of urinary tract infections intricately linked to underlying health conditions or structural abnormalities within the urinary tract. Conditions such as kidney stones, urinary tract obstructions, diabetes, pregnancy, neurologic disorders that affect bladder function, and immunosuppression predispose individuals to these complex infections. Unlike uncomplicated UTIs, which primarily affect the bladder, the complicated UTIs extend to involve the kidneys, the ureters, and other parts of the urinary tract beyond the bladder. Symptoms of complicated UTIs tend to be more severe and may include fever, chills, flank pain, nausea, and vomiting, which necessitates prompt and comprehensive management to prevent potential complications. This table was taken from Up to Date, and it helps the process of choosing antibiotics to treat acute complicated urinary tract infections based on the general guidelines. So we are assuming that our patient population is outpatient. There is no risk for MDR, so the patient hasn't traveled to any parts of the world with high rates of the MDR organism, and there's no concern with fluoroquinolones, so low risk for adverse effects. So if everything is a no on this page, we will go to the first line of treatments. So patients with low risk for fluoroquinolone resistance slash toxicity, we would choose ciprofloxacin 500 milligrams orally twice daily for 5 to 7 days, or we could do ciprofloxacin extended release 1,000 milligrams orally once daily for 5 to 7 days, or this levofloxacin 750 milligrams orally once daily for 5 to 7 days. We're just going to choose the first one, which is the ciprofloxacin 500 milligrams. Treatment for acute complicated UTIs often includes antibiotics like ciprofloxacin, as we discussed on the previous slide. So let's just assume we chose the ciprofloxacin 500 milligram twice daily orally for 5 to 7 days. Now we could discuss some contraindications and adverse effects. Fluoroquinolones are effective against a broad range of bacteria. However, its use is contraindicated in individuals with known allergies, if the patient's pregnant or lactating, and patients under 18 years old due to potential adverse effects on developing cartilage and bones. Dose adjustments are necessary in individuals with renal disease to prevent toxicity, and caution is warranted in patients with myasthenia gravis, as fluoroquinolones may exacerbate muscle weakness in these individuals. It is also essential to be mindful of potential adverse effects that are associated with ciprofloxacin. These include common symptoms such as headaches, dizziness, gastrointestinal upset, as well as photosensitivity reactions. Some more serious adverse effects may include dysrhythmias, hepatotoxicity, and the risk of prolonging the QT interval. Now, ciprofloxacin does carry a black box warning for tendinitis, which necessitates careful monitoring during treatment to mitigate these risks. When administering ciprofloxacin for the treatment of a complicated UTI, it's essential to adhere to specific nursing considerations. Patients should be instructed to take ciprofloxacin at the same time each day on an empty stomach, as food can decrease its absorption. Additionally, make sure the patient has adequate fluid intake with at least 6 to 8 ounces of water when taking the oral antibiotic to enhance absorption as well. Patients must complete the full prescribed course of treatment, even if symptoms improve, to prevent the development of antibiotic resistant infections. In case of a missed dose, patients should take the medication as soon as possible, unless the next dose is due within 6 hours. Also, patients should be advised that ciprofloxacin can increase sensitivity to sunlight, necessitating precautions such as wearing protective clothing and using sunscreen when outdoors to prevent a sunburn.